If you live with rheumatoid arthritis and your back has started acting up, you're not imagining it. While RA doesn't usually start in the spine, it can still cause pain there, and sometimes that pain can point to something much more serious. And yes, I'll also talk about a rare complication called cervical instability that can cause permanent damage if it's missed. I'm Dr. Neha, a rheumatologist, and in this video, I'll explain when RA is mechanical, but when it might be inflammatory, and which gentle movements can help protect your spine. Let's dive in. Rheumatoid arthritis usually affects the small joints, whether it's your hands, your wrists, your feet, ankles, but its impact can go way beyond that. Chronic inflammation, which is what an autoimmune disease is, can affect your muscles, it can alter your posture, and change the way that we even move. Imagine walking with sore or stiff hips, or if your knees hurt, your body usually compensates, and it shifts the weight this way and that, and even how your back muscles can work. Over time, that can cause mechanical strain and cause back pain. Even though the inflammation isn't technically in your spine, it's made its impact. So for most people with rheumatoid arthritis, back pain is secondary. It's a ripple effect of how the body is adapting to the joint pain and fatigue. But there are a few cases where RA can really affect the spine, and that's where things can get serious. When rheumatoid arthritis does affect the spine, it's usually in the cervical neck region, specifically between the first and second vertebra. We call it C1 and C2. In this area, rheumatoid arthritis inflammation can weaken the ligaments, and they hold those little bones in place. Over time, this can lead to something called atlantoaxial subluxation, the fact that it can really impact your neck in that specific spot. More simply put, it's cervical instability. When these vertebrae shift even a little bit, they can press on the spinal cord, and that can lead to permanent nerve damage if it's not treated. In severe cases of this, if that compression becomes very serious, you can get neurological problems like numbness, weakness, coordination problems, and in a worst case, even paralysis. This is why any new neck pain, numbness, weakness, especially in somebody with long-standing rheumatoid arthritis, not usually in newly diagnosed people, it's usually like you've had disease for a very long time, that really needs to be evaluated quickly with imaging. And remember, this is rare, but it's critical to catch. Imaging can detect it early, like x-rays, MRI. That can really help find it early before damage really occurs. For everybody else though, back pain in RA is usually a much simpler explanation, more with mechanical strain, and that's what I see most often in clinic. You may have heard your doctor say the word deconditioning, and that can happen even if you're taking medications. RA fatigue and pain can make it hard to stay very active. And over time, those muscles that stabilize your spine, your core, your glutes, even your back extensors, they can get weaker. That lack of support can make the spine ache even without inflammation. So while your medications treat inflammation, movement is what protects the muscles, which protect your joints. Let's go over a few safer, low-impact exercises that you can do at home, especially for people who have back discomfort. First, you can try something called pelvic tilts, and these are done either lying or seated. They can help activate the core and gently mobilize the lower spine. It's perfect if you've been sitting for long hours, which I would say a lot of my patients do because they have very sedentary jobs behind a computer. Then there's the cat-cow stretch. This improves flexibility and circulation along the spine without too much additional strain to it. You can do it in the mornings, you can do it throughout the day, maybe a break between different tasks. Number 3, the bridge pose. If you can tolerate, this can be a little bit tougher. This strengthens the glutes and the lower back muscles, and this can help stabilize your posture over time. Number 4 is the seated side stretch, or something called child's pose, which is what it's more commonly called. This reduces the tightness in your back and your shoulders, especially it's common with people who have a lot of fatigue. These movements can be supportive, but they're not curative. If you're having a big flare, avoid high impact activity and check with your rheumatologist or your physical therapist to start anything new, because you may need much more than this to help support your back. These don't mean that you can't move, it just means that you have to move wisely, and you may need to get it worked up to make sure it's not something worse. Sometimes you'll need to do it with dedicated people who are trained in this, like physical therapists. As a rheumatologist, my job is to calm down inflammation, and our medications can do this. The RA medications can reduce or stop inflammation that causes long-term damage. But movement, posture, and strength are really what keep you functional and resilient. Think of it this way: medications quiet the fire, but movement rebuilds that house. If your back hurts and you have rheumatoid arthritis, it's usually mechanical, but rarely it can be a sign of cervical instability, which is why awareness matters. I think about 2 people over the last several years had very strange presentations of rheumatoid arthritis, where their disease was only in the neck, nowhere really else in the body. And as you can imagine, it took so long for them to get diagnosed with rheumatoid arthritis because this is not usually what we see. Luckily, they're both doing well and they're stabilized, but I do wish we had gotten to them sooner because our medications may have made a better impact in the beginning. I hope this helps you understand a little bit more about back pain and RA and what you can do to help support your spine. If this video helped, please share it with somebody else that might benefit, and check out my next one on rheumatoid arthritis and different ways to improve health with it. Dr. Neha with Plant Forward MD. See you next time.